We are greater than me.
When we come together, we can tackle the most difficult issues that connect us all.
Hey neighbor, we're there for you.
Let's change the course of mental health.
It's time we hold up those that are struggling.
Let's give a hand to those that feel helpless.
Show compassion and act with empathy.
Empower the hurting to heal.
We are driven and united with purpose.
Together,
We can make hope happen.
Well, good evening, everyone, and welcome to our podcast this evening, I guess, that we're having. And I'd like to introduce all the panelists that are going to be on this call with me this evening. First of all, we have City Council Member Natalie Mosier. Welcome, Natalie. Marshall Moncrief, CEO of Be Well OC. Oliver Chi, City Manager, Huntington Beach, and of course, Chief Julian Harvey, our Huntington Beach Police Chief. And it gives me great pleasure, and I really feel honored to be on the call tonight just to share my own experience with homelessness since I've been on council. The problem certainly has been a big one, and I think our city has really reached out to a lot of the services that are available out there, and we're finally getting some to really move along. I know my own work reaching out to other people in the county and meeting professionals in the industry has helped me a great deal. I came back to the city and encouraged staff to look into the program. And so tonight you're going to be hearing about Be Well OC and the impact of mental health here in Orange County. And of course, we'll leave time for question and answers. And so what I'd like to do now is turn it over to City Council Member Natalie Mosier.
Thank you very much, Councilmember Douglas. I am so excited that we're here tonight, having these conversations. I have been involved, like Barbara, with the homelessness issue for a number of years, not quite as long as Barbara, but it's really the way that I kind of got engaged with the community around this challenge and realized that, tonight we're not going to be talking about homelessness alone, really. It's about mental health. And mental health incorporates, as we'll be finding out tonight in our approach to it, it's working on the challenge of homelessness. It's also mental health as a community issue and looking at different ways to approach it. I think as council members, we know that public health and safety is just of the utmost importance. And that doesn't just mean, public safety through the police department. That also means health and safety of our entire
Natalie, I think you're
homeless community. And so
on mute.
Our residents with addresses and without addresses. I think that the city's partnership with Be Well, I'm so excited to be able to really introduce Be Well and Marshall to the community. I know tonight is really more of an introduction of the program, with next week having a little bit of a deeper dive into what our pilot program will be here in the city of Huntington Beach. But I just know it's going to be such an amazing success with a bunch of people who are really deeply committed to helping with the health and safety of our community. So with that, I'm going to pass it over to Marshall Moncrief in just a moment, but I just wanted to let everybody know this evening, please go ahead and throughout the event, feel free to submit your questions in the comment or the chat box from whichever platform that you are participating on this virtual town hall from, and we will make sure to try to answer those near the end of the event. So add them as you go through and we will do our best to get to those. And now I'd love to pass this off to Marshall Moncrief from Be Well, Orange County.
I could have predicted that. Thank you for having me, Natalie, Barbara, Chief, and Oliver. Really appreciate being here. And I'm pleased to have the chance to talk about Be Well and what we as an Orange County community are doing in mental health. It's even more of an honor to talk with everybody here tonight about what we're going to be doing in Huntington Beach because I'm a resident here along with you all. And so this is home. My kids go to school here, and we work and live here, and see you all of you in Central Park and at the beach and all around. And so this is home, and we've got an opportunity to do something really impactful. And so, like Natalie and Barbara queued up, we're going to talk a little bit right now tonight about sort of the global picture of mental health in the country and in Orange County, and then look forward to joining, hopefully, several of you, all of you, next week and talk more in depth, as Councilwoman Moser highlighted. And I really appreciate the way that you guys framed up mental health. It's so accurate that when we think of mental health, it's hard not to think about a population that's struggling with homelessness. Not everybody who is homeless has a mental health problem, and not everybody who has a mental health problem is homeless. But the overlap between the two is pretty significant, and we will not solve one without the other. And at the same time, when we talk about mental health, for me, I get a different image than some of you might get in your mind's eye. And that image is of somebody struggling with homelessness, but it also is an image of you and whatever it is that you represent in the community. We deal with that from a mental health perspective. And so when I think of mental health challenges, I think of the kids in our schools. I think of the parents that are helping them navigate, particularly over the course of the last year. I think of the teachers and all of their enormous work and courage to manage all of that over the last year and prior to COVID and always into the future. I think of faith leaders and people of various faith communities. I think of all the young people at our community college, and I think of the men and women in law enforcement. So you get my point. All of those people are impacted personally by mental health and substance use issues and deal with mental health through their respective contributions to this community. And so, yes, we will be talking about and interacting with the population struggling with homelessness. And this is a topic relevant to every single one of us. I get a phone call, at least one a day, at least, and I have not been active delivering clinical care for some time. I'm in more of an administrative role, and not a day goes by where my phone doesn't ring, where somebody in the community is calling on behalf of a loved one looking for care. And that's part of what we're going to talk about today too, is the difficulty of the illnesses themselves, exacerbated by the difficulty of a lack of a system designed to be responsive to the needs. And that's what Be Well is aiming to address. So I'm hoping pretty soon here we'll pop a slide up so that my face gets smaller, which will be much better on me. And we can look at something else, and I'll kind of walk and talk us through it. So to set the stage, I want to walk you through some data points of what mental health looks like in the country and in our community of Orange County. And so right now, when we're talking about mental health, and throughout this talk, when I say mental health, I'm including substance use disorders and all of the variants of mental health. The problem is going up. It's getting worse. And so nationally, which also translates to the state and also translates down to our county and in any community USA, about 20% of the population at any given time is experiencing a mental health disorder. So a pretty significant number. And so in the little orange bullets I've got on the slide, you'll see some comparisons with illnesses of traditional medical type that we're really familiar with and pretty comfortable talking about. So cancer care, COPD, chronic obstructive pulmonary disease, Alzheimer's. Those are really big medical challenges that we all face. And you can see in the little orange numbers, when we compare those to mental health exceeds those by many multiples. When you start to break down mental health versus addiction, both of them still beat out many of these illnesses, and by cost to the population. So, for example, there was a projection several years ago that in 2020, cancer care would be costing the United States a little north of $200 million a year, $1 billion, pardon me, a year. And in that same year, this was around 2016, mental health and substance use disorders were already costing the country over $600 billion a year. And so there's multiple ways that we want to approach this as a community. For me, it's heart-led first. These are painful illnesses, and we need to meet them with the same compassion and quality care that we meet every other medical illness. And there's also an economic interest for all of us in helping to solve for it, because having a broken system is expensive on top of being painful. If we can move to the next slide. So in addition to the problems going up, the treatment beds are going down. And so I don't know that it's useful to have that green box in there. I probably story is on the 3 orange bullets. And so what research shows is that in a given community, you need about 50 mental health beds per 100,000, 50 psychiatric beds. The California number in 2017 had dropped to as low as 17. And right now, today in Orange County, our community, where we need 50 per 100,000, we have 15. And so our Orange County community is about 3.2 million people. And so if you do the quick math, if I'm close to right, I think it's about 1,600 beds that we would need. Right now, we have 500 beds. So we're a good 1,000 short. So that is definitely a need we need to address as a community. And I'll talk a little bit later, the number of mental health beds we need is important, and we are definitely underbedded in Orange County. However, the number of beds that any community needs is contingent on how well we're doing care in the rest of the care environment. And so many of you get your care at Hoag Hospital. I worked at Hoag Hospital for a very long time and know the system really well. And when we think of Hoag Hospital, there is the hospital that has treatment beds for when people are ill. But Hoag is more than that. It has urgent care centers. It has ambulatory surgery centers. It has primary care clinics. And so there's a whole bunch of access points to medical care that hopefully most of us are getting before we ever need a hospital. And hopefully hospital-based care is very few and far between for most of us. It needs to be the same thing for mental health. So do we need beds? Yes, we need more beds. Do we need to be doing more than just building beds? Absolutely yes. We need to be driving care upstream and out into the community as much as possible if we're going to meet the needs and bend the curve and take those numbers we saw on the last slide and start seeing them slope downward. That's the goal. Okay, so the problem's going up, the beds are going down. That's not super ideal. We're going to stay in the problem for a minute here, and then we'll start talking about the solution. Oh yeah, you guys were right on with going to the next slide. So in addition, we don't have enough providers. And so when we look at psychiatrists, for example, right now, 2020, 2021, we're meeting about 80% of the need with the number of medical psychiatrists we have available for our community. You can see in 2028, which is coming quickly here, we'll be at 50% of the need. That same statistic is applicable to all of the other mental health licenses. So psychologists and social workers and family therapists. So problems going up, beds are going down, and provider numbers to need is also going down. So we've got a challenge in front of us. Next slide. The access, therefore, is poor. And so what this shows you is on the left-hand side, in that dark blue bar, that says the general public says when asked that mental health is difficult. It's difficult to find resources. It's difficult to access care. The general community says that. About 50% of them say, yeah, from what I understand, it's hard to find mental health when you need it. The light blue bar on the right-hand side, of those people that actually went out and sought mental health treatment, 2/3 of them confirmed, yeah, it's really hard to find treatment. And so the access is not good. We can go to the next slide. So the impact of this, because the problem is going up, beds are going down, provider numbers are down, we're not doing a good job of meeting treatment needs upstream. So crises are getting higher in number. We have a higher frequency of mental health crises. Because we don't have a unified, easily accessible crisis system for mental health, oftentimes law enforcement and emergency services are our default. I don't know where to go. I'm in the heat of a moment, and so I'm going to call 911. Today, I told you guys that I get a call every day for mental health. Well, today I got a call from somebody, a well-resourced family, and they are in the Newport Beach area, and with a child who's psychotic. And they did not know what to do, and already called 911 before through multiple connections, found my number and called me. And so that family is well-resourced, well-connected, and in the moment of a mental health challenge, an acute crisis, did not know where to go, who to call, or what to do. It is scary, it's confusing, and so 911, please. And then teams like Chief Harvey's or emergency responders come out to do their best to help with the situation, and oftentimes are limited in the access that they have to provide the person, and so hospital emergency rooms become a default. And I shared with you, I have worked at Hoag, I've also worked in the St. Joe's system and many other hospitals, and I can tell you the emergency departments, those people and law enforcement and EMS work exceedingly hard, and the ER is not designed for that care. And it's difficult for the patient as well as it is for the provider. So we need better options. Those are high cost solutions with relatively poor outcomes because they weren't designed for the care. If I had a heart condition and went to the cancer center, you'd have some really good loving people who have some capabilities, but those capabilities aren't aligned with the illness that I have. And that's similar to mental health and where care ends up happening. The good news is one of my team members, who used to be the chief executive officer of Hoag by chance, tells a story which I love, and I'm going to borrow it from him right now. And he tells a story of in Orange County. It wasn't more than maybe 10 years ago, we didn't have a system for stroke care. And so when somebody had a stroke, you would be lucky if the person sitting across from them knew the signs and symptoms of stroke. And when you called 911 for emergency response to come out, and emergency response takes you quickly to a hospital, you were lucky if the hospital had the right training and standards of care in place, the right stroke protocols to respond. In that time, we have created a system for stroke, and that's been done collaboratively with multiple partners. And so the counties, cities, health systems, we've pushed out information to help the community recognize stroke, the signs and symptoms, so that when you're sitting across from someone, you can respond. Ambulances and emergency responders are better educated, and we have identified stroke receiving centers that are specialized for that need. We didn't have that system. The community came together and built that system. And if we can do it for that, we can do the same thing for mental health and the mental health crises. And that's what we're embarking on now. So one more data point that kind of highlights the problem, and then we'll shift into maybe some good news about solution and community rallying to solve for this. If you guys go to the next slide. Another data point, and this is coming from a hospital person, in Orange County, because of everything we just talked about, there's about 50,000 emergency department admits every year for a primary mental health or substance use disorder or both. And that's not just the homeless population, that's an all of us population. So 50,000 admits every year. The average cost of one of those admits is about $2,000. So in Orange County right now, all of us can be committed to wanting to change a reality that we're spending $100 million a year for poor access to inappropriate care that's largely avoidable. And that's one data point. We could get many others from our law enforcement partners, from emergency responders of all types, about the impact on these systems because we don't have a unified mental health system. And that's what we're going to talk about right now, is Orange County coming together to say, we can do better than this. In fact, if we rally, Orange County is a community of action, and we can be a national leader in how we rally the public sector, the private sector, the academic community, the faith community, private business, and everybody chip in and pitch in for a unified system of care that meets the needs of our entire community in a way that we had come to expect for every other medical illness that we struggle with. So I'll maybe advance the slide. If this one you might want to maybe make bigger, and I don't know if that even gets me off the screen to make it bigger, be even better for all of us. But so on the left-hand side, I want to walk you guys through the way that many of us see and visualize where we are today as a community and where we're trying to go and how we're trying to get there. So kind of orient yourself. I don't know if you can see my arrow moving around or not, but on the left-hand side of the screen where it says fragmented services, I'm going to talk you through what all that stuff means there. Some of you might have really big screens at home and can read what's on those little flags. Others of you might be looking at this through a smaller screen and not be able to see the names on them. The drifting little color flags represent the various sectors of our community. And so there's the faith community, like I mentioned a minute ago, the academic community, so our schools and universities. There's the healthcare systems. There's the housing sector, the criminal justice sector. There's community advocacy. There's parks, recreation, all sorts of sectors of a community. All of them deal with, oh, that's great, thanks guys. All of them are dealing with mental health and substance use disorders at increasing numbers. And all of them are trying to address the problem as best they can through the limited resources and the limited scope of view that they have with their sector, or even more narrow, their organization. Everyone's working hard, but they're all drowning. And I will be the first to raise my hand as somebody who's been 20 years in hospitals here to say, we have been working really hard and we're drowning. Amidst all of those fragmented sectors doing their own thing in the best way possible, but siloed, amidst that fragmentation are the human beings that need care. And so some of those people have insurance, some of them don't. Of those that do, some of them have commercial insurance. Some of them have maybe a public plan, like a Medi-Cal plan. Regardless of whether they're insured or uninsured, regardless of whether it's public or private, commercial, their clinical needs vary from mild to moderate to severe. So all of these dynamics, I'm not going to hang on it too much longer, but I want to emphasize the point. All of these dynamics create massive fragmentation and a big giant maze for the families that are trying to navigate to get to care to figure out. And so I have to find the right key, and then I have to go find the right door to get into treatment. And so unlike every other medical illness where there's a path of travel that guides you to the right care, for those people with mental health disorders, it's salt in the wound. It's pain on top of the disorder itself to try to find and access good care. We need to solve for that. So the middle, if we kind of go back to one holistic view of the slide for a sec, and then we'll focus in on the middle. So what we're trying to do is take that fragmentation, put it through this blueprint that the community created called Be Well Orange County. And I'll tell you about it in more detail in a second, so that we come out the other side with all these fragmented pieces looking like the right side of the screen, where it's one unified ecosystem that wraps a hug around the whole of the community, regardless of their insurance or their clinical need, and assures them easy access to high quality care. And it's going to take all of us to do that. It's going to take all of the sectors of our community and all the organizations of our community to do that, because the problem is too big and no one sector and no one entity can do it alone. But this is like the stone soup approach of mental health system build, because we've all got something to contribute, and we've all got to chip in to make it happen. So to talk for just a minute about the blueprint structure in the middle, so that's the roadmap of how we take all this fragmentation on the left and start to bring it together for the outcome on the right. So I'm going to walk this through like a clock. So if we start at 12 o'clock and work our way around, what you're seeing are result areas. So these are the areas where we want to see demonstrable, measurable outcome across Orange County. And so we're starting with stigma reduction. In mental health, we don't talk about it much. So when someone's struggling with cancer, there's a lot of casseroles that come, and the families rally and hug, and the faith community rises up, and we wrap love around that person and excellent clinical care until they're better. In mental health, we're not likely to talk about it. We sit in the silence and the shadows of it, and it's a painful thing. And so stigma reduction and our ability as a community to start talking more openly and to embrace this as just another healthcare issue that demands the same clinical caliber and compassion we give everything else is critical. So that's a result area of Be Well, is we want to rally the community and all of those people that currently work on stigma reduction and more to channel together in the same direction to make a bigger impact. That's what these little gray circles represent, is all of the entities that currently do work in that space coming together around a shared plan of action to move the needle in stigma reduction. And it's the same thing in these other 6 areas. So prevention and early intervention. So now we've got 2 upstream oriented focus areas, stigma reduction and early intervention. And then down here, continuing to go around the clock, we've got closing the treatment gaps and improving access. So that's a little further downstream. When somebody has a mental health illness, let's get them easy access and close the gaps between providers. And then strengthening the crisis response system. We're going to talk about that a lot next Wednesday and give you a little bit of a planting the seed on that topic tonight. So how do we strengthen the crisis response system in the same way we did for stroke? And then establishing community wellness hubs. So in Orange County, we think if we're going to put a material dent in the 50,000 people that are regrettably getting care in the wrong spot, we need at least 3 comprehensive care campuses strategically located across Orange County so that everybody has good access. So that would be something north central, something in South County, and something probably central coastal. And if we had these comprehensive care campuses that have mental health treatment and substance use treatment, and they're available for everybody and kind of geographically accessible to everybody, we could have a major impact at getting people great care when they need it. And then the last one up here, aligning policies, partners, and programs. That's really making sure that our mental health effort lines up with other synergistic needs. For example, there's a tremendous effort across Orange County to solve for homelessness. Huntington Beach is taking some bold, amazing steps with our city council and leadership to address that problem. So what Be Well does with mental health, we fundamentally have to be aligned with that homeless services effort, or we're losing impact on both counts. So that's sort of Be Well. And the organization that I represent is this little black circle in the middle that's designed as kind of the neutral Switzerland that facilitates all of these partnerships on behalf of the community to get things done, like Build Buildings, our 3 comprehensive care campuses, or like launching crisis response systems, and those sorts of things. And so that's the thesis of Be Well. Let's take the fragmentation, unify as a community, but in an organized and structured way so that we have a shot of actualizing this vision of a unified ecosystem that wraps a hug around everybody. That's Be Well. And so if you go to the next slide, these are specific things that are happening under some of those 6 results that I just talked about. These are tangible, practical things that I want to share with you. And so we need, for example, a navigation system. For shorthand, I call it the Amazon of mental health. And for whatever people like or don't like about Amazon, it's not about that. It's about the concept of what Amazon does well, like it or not, is you click the button and you get your couch or your shoelaces or whatever it is, and they figure out the complexity behind the scenes. If we can do that for the marketplace, we should have something that easy for mental health, whether I am concerned and think my child might need a therapist to somebody is psychotic in the street. I need one place to go, make it simple, and you figure it out on the back end how to make it work. That's a responsibility we hold. We're working with the public sector, with the private institutions to start to work on that. So that'll be a future state goal. The mobile response program, when somebody calls into that navigation system and someone is in a crisis in the community, we need to be supportive of law enforcement. We need to be supportive of our emergency responders, and we need to get something out there that's agile and specialized to meet that mental health need in the community, whether that's in the street or in the church or at the school or in the living room. Get help out to the people that need it. And that's the mobile response program that would be a complement to this navigation system. Somebody is in need. We'll take the person I talked with today who is having a psychotic situation, and someone calls in the navigation system. It deploys the mobile response, and it looks like this young person needs to go to a place of care. And so we need to build those 3 regional campuses so that we can get that person into easily accessible, high quality care, specialized for the challenge she's experiencing, not an emergency department. And I have this highlighted in an orange box because we're making really great progress with these campuses. And I want to use the last few minutes to be able to tell you about it and to show it to you so that hopefully people will feel encouraged that this isn't just a fluffy dreaming. There are a lot of people across this whole community who are leaning in and saying yes to make these things a reality. And we're on the precipice of something pretty remarkable in Orange County, something we can all be very proud of. And the last thing is a network of care, and we'll do a town hall down the road sometime and talk about that. It gets a little bit wonky, but essentially, when you need access to mental health care, an individual provider, we need to do a better job of finding ways to make that accessible. Because right now people are calling looking for therapists, counselors, psychiatrists, and they're finding that there's months worth of waiting lists. We're going to have to solve for that. And we're going to have to solve for the deficit of providers I shared with you before. So if we're looking at 2028, having 50% of the psychiatrists we need, 50% of the therapists, we're going to have to get creative about what constitutes a provider in a network and get more expansive in our thinking. For example, people with lived experience could be empowered as coaches to be available to meet mild symptoms and help with that. We can leverage digital assets and make sure that cognitive therapy is deployed to people who have mild symptoms and get that stuff upstream more easily. So thank you so much for letting me talk through this. What I'd like to do for the last few minutes is focus on the campuses, because it is something actually tangible, physical, that's happening right now. We just finished the first campus in the city of Orange, and it's a 60,000 square foot facility. It's a first of its kind in the state, and maybe more broadly than that. And it's really, we're really excited about it. It has 7 different services in it, a full continuum of mental health care, and a full continuum of addiction care. And this little single story part of the building is almost like the urgent care equivalent of substance use and mental health. So we have a recovery station for people that are intoxicated and need help. We have what's called a crisis stabilization unit, one for adolescents and one for adults. So those are people in mental health distress, a serious mental health distress. And instead of going to an emergency department, they can come here and get a hug wrapped around them and get the right clinical care immediately deployed by the providers who are trained to do nothing but this and who have no other distractions but to do this. When you think about an ER, those are my friends and family that run those, and they're the most wonderful people in the world. But when I come in and I'm struggling with a psychotic disorder, the physician that's assigned to me has 30 other people. Some of them are, they're bleeding out their eyes, they're having a heart attack, they're having a stroke, all of these things. And so the time and attention that I'm afforded doesn't line up with the illness I'm there needing treatment. And certainly the environment with all the noises and the lights isn't aligned with it either. So this is a specialty place designed just for these challenges, which help us stabilize the problem much more readily. And then in the second and third floor of the building, we have successive levels of care, both for substance use. There's a detox and a 30-day residential. For mental health, there's a crisis residential and a 30-day plus treatment facility. So somebody coming into this facility can move through the entirety of that continuum if that's what's needed, or if one service meets their needs and they can be stabilized and referred back out into the community, then wonderful, it's there. This facility works in very close collaboration with the hospitals of Orange County and to make sure that we're giving highest quality care and in the safest way possible. I'm finding myself starting to speed up because I'm looking at the time and I know we need to land so that we can have a conversation and answer questions and things. I think there might be a video of the facility. If we have that and you want to show it, wonderful. If you want to call it here, then we can do that too. Natalie, I'll look to you or Barbara and for your guidance.
So what I'm doing now is I was just going to ask a question and then Natalie can ask if that works. Okay, Natalie?
Sure, and let me also encourage people to go ahead and continue to add your questions to the chat boxes as well as we're
thank you for that.
now.
Thank you for that. So one of the questions I see here is there's kind of a couple that are right together. How much does it cost to utilize Be Well OC? Do I need insurance to use Be Well OC? And what are the plans for Be Well OC in Huntington Beach?
So the unique part about the Be Well facility that you just saw is it's one of the few places you'll find that's available to anybody, regardless of their insurance status. And so if somebody has a Medi-Cal insurance, then come on over. We want to help. If there's commercial insurance, we want to help. And if there's no insurance, then we're going to either help or connect you with help. So the cost question is difficult to answer. I'm happy to connect with anybody in the community who wants to talk maybe more specifically about a situation, but there's a lot of variation to individual clinical care that impacts that. But this facility is designed for people who are in crisis, who need access, easy access to highest quality care to get them in regardless of their insurance coverage. That's the goal with Be Well. And in Huntington Beach, we're going to talk more specifically next week about some just outstanding program plans for a pilot program that is around the mobile response. And I'll let Natalie and Barbara steer some of that.
Okay, Natalie, you want to go ahead and ask the next question?
Sure, I'm going to kind of go around on the order of things here. I think that, I have two kids, 11 and 13, and I think especially for, the youth during this time, there has been an increase in a lot of mental health issues. So I feel like this couldn't come at a better time. But I was wondering, and people were asking also, how are you addressing the many people who are in crisis now? And also with that, actually answer that first, and then I'll ask the second part.
There's a few really promising things happening to address crises. One, I want to call out the NAMI Warm Line. The NAMI Warm Line has been around a long time, but in a relatively modest way. And in response to COVID and the growing needs, they have now expanded their team. They've gone 24/7. Yes. Yes, thank you for that. So NAMI, NAMI, is the National Alliance of Mental Illness. And they're an amazing organization made up of individuals and families with lived experience in mental health. And they do lots of things. They have family-to-family education groups and support groups, and they do a ton. I really encourage everybody to visit NAMI Orange County on their website. But one of the things that they do is a warm line. So they have a staff of trained call center listeners that are available 24/7 to be responsive to people that are struggling. And sometimes that's exactly what a community member needs, is somebody who's empathic and understands to connect with and listen. And in the case where referrals or resources might be needed, they can connect you. So that's something that's increasing in Orange County right now in order to meet the growing demand. The other thing that's happening to meet the increased crises is what Huntington Beach is leading with this pilot program for a mobile response solution to crises. And I keep referring to next week because that's when we'll get more in depth. And we're all excited to share that pilot with you. But Huntington Beach is on the front edge of thinking through what the community needs are with respect to crises and coming up with solutions to address them. I will say, for those people that are struggling with mental health crises, while we have a lot of promising things coming online, I also want to let you know that we hear you and we understand how difficult this is, and we understand that everything that's happening still is not sufficient, and we have a lot of work to do ahead. And so I want to be realistic with each other as well. There's a lot to do to improve the system.
Natalie, would it be okay? Did you want to ask another question? Natalie, can you hear me?
Well, actually, I think the next one that we received, yeah, the next one that we received was, I think, related to this. Somebody had mentioned that they work in a mental health call center currently, and the number of people who are actively suicidal have increased drastically in the last 6 months. Can you speak to that, Marshall?
I can only in that it underscores deeply what we've been talking about here. Um, you know, regrettably, before COVID, um, depression, substance use, and suicide all were considered epidemic challenges in their own right, each one independent of the other, prior to COVID. COVID came in and poured fuel on the flames of those crises and has exacerbated all three of those, including increase in homelessness. And so if we had a problem before, now our problem is stronger. If we're looking at a silver lining to that, and I know that's hard to even say in the same sentence, but the thing that has done is it has rallied the political will of our community to acknowledge that we need a better infrastructure to respond to these things. And to get there is going to take all of us. And so it isn't going to be one hospital that puts up a new service that solves for it. And it isn't going to be one city that does something. This is a whole community, county-wide effort that has to come together with our collective resources to have a collective impact to create a responsive system to those needs. And we have a long way to go. And we want to ask for everybody's patience and encouragement and participation. Jump in. So if you're a librarian, jump in. If you're a school teacher, jump in. Like, we need everybody's brain and resources to jump in on this thing if we're going to move the needle. And the positive news is people are. And so Be Well has become a platform that's inviting community to come in so we can lock arms and start to address this thing. And that's not Pollyanna fluff.
No.
I mean, you just saw there's a concrete building that wasn't there last year. It's there now. And in a few months from now, there is not a mobile crisis program in Huntington Beach, and you're going to see us driving around in our van, waving hello and helping a hand in a way that isn't there today. And so there's concrete action happening. And we've got to rally around that as a community and enhance these things.
Marshall, I'm just going to put a couple together here, and then you can go ahead and address them. Is there another number for call services that should be used right now besides 911? Are you doing anything with combat veterans suffering from TPI and PTSD? And there's many people who are in crisis right now. How can we help them? So it's kind of what you've been talking about, but if you could maybe address those.
Yeah, I think the phone number piece first. The NAMI warm line is just an amazing, very compassionate, friendly number to call, and they can connect people to support. Many people are already aware of, if you're not, you should be. 211 is a great place to get connected to resources and referrals. And then the other one is OC Links. And you can find all these things with a quick, Google search. The OC Links and the NAMI Warm Line, Google NAMI Warm Line OC and Google OC Links. And these are phone numbers to resources and referrals that can be really helpful. If you happen to be holding an insurance card in your wallet, whether it says Aetna or Blue Shield or whatever the heck it says, or it might say Cal Optima if you're on a Medicaid plan, there is a number there that connects to mental health support services. That's another way to call. And so those are 4 options. And going back when I showed you that picture and there was kind of the 4 things we're working on and navigation was the first one.
Right.
That's what I mean by we need an Amazon of mental health where we don't have 4 different numbers and there's probably 5 others that I'm forgetting right now. We need to start to centralize that into one number that's easy to access. There's something moving forward at the federal level. I'll keep it brief, but you guys can tune in and search for this. In the way that we currently have 911 for traditional emergencies, 988 is now being approved and going to start to come active as a mental health crisis line.
Oh, good.
So there's a lot of work to do to figure out how that's going to be operationalized.
Yes.
But just people should know that things are headed that direction, and it's a hopeful sign.
Marshall,
the numbers I just said are I think the ones to call.
I wanted to give the audience the Orange County warm line.
Yeah.
It says area code 714-991-6412. That's NAMI Orange County.
Thank you.
714-991-6412. Does 211 offer emergency services or just services?
They're a resource and referral line.
Okay.
So less emergency services.
All right.
All of these things, OC Links and 211 are resources and referrals. Oh, hey, thanks for putting that up. Awesome. And then the NAMI warm line is just that. It's people that are going to answer the call, be there empathically to understand your situation and walk you through it. And if you also need resources, they can connect you.
Natalie, did you want to add anything?
Did we end up covering the concerns about combat veterans?
Oh, no, we didn't.
From TBI
Thank you.
and PTSD.
Thank you for that. Yep.
Yeah, thanks, Natalie. So under that Be Well structure that I showed you, all 6 of those result areas, there's a lot of specialty populations that are being addressed. And so we need to do more, quite frankly, with that work that's specific to veterans. And so there is a lot of work happening in Orange County around veterans. Under the Be Well umbrella, that's an area that needs to improve and strengthen. But I'll also say this, when you talk with anybody about mental health, there's a lot of interpretations on what the priority focus needs to be. So for example, if I say healthcare, that's everything from Band-Aids to brain surgery. There's a lot of things in healthcare, and it's the same thing in mental health. It's just as expansive. And so the question is super important about what are people doing for veterans. It's massively important. And the same conversation is happening around new moms and postpartum depression. And the same conversation is happening around substance use. And the same conversation is happening around early psychosis. And the same conversation is happening around a lot of different populations. And so what I'd like to invite our community here to do is, as you have a specialty population, visit bewelloc.org. We publish when these meetings are happening across all of these different topics. And we would love to have people who are focused on a specific population step in and start to lift with us some specific channels of work to address that. But nutshell, we have more to do with the veteran population.
I have another question, and this was actually my question. I know next week we're going to talk more about the mobile crisis response and specifically, in these crisis moments. But one of the things in the blueprint was talking about preventing and acting early. And so my question is, how does self-care and preemptive care integrate with these efforts?
Well, it's massively important. Our medical director is also one of the head psychiatrists at UCI. And as an example, a concrete example to what you're talking about, his name's Robert McCarran. And he does a train the trainer program where he trains primary care physicians to train other primary care physicians on mental health identification and how to intervene. And so that's a really powerful way to move mental health into the mainstream of healthcare. And so whether it is a new mom or a child in a pediatrician's office or whomever, that the primary care provider is better equipped to deal with the problem in the same way that that primary care provider is better equipped today to deal with early signs of diabetes or early signs of congestive heart failure so that the intervention is more powerful. That's one concrete way. We also have a lot of work going on with Chalk Hospital and other partners around children's care. We have an entire initiative right now around ACEs, which stands for Adverse Childhood Events. And there's about 20 some odd entities across Orange County that have come together to create a network style response for children who have experienced trauma in order to get upstream and prevent those things from becoming long-standing mental health problems. So there's quite a lot that is happening and quite a lot still that needs to happen. I think, Natalie, I'm not sure if you're frozen or maybe it's my computer. Yeah, I think Barbara's muted and Natalie's frozen.
Okay. Okay. Can you hear me now?
Yeah.
Okay. So, Chief, one of the questions was, what are the police doing to manage the mental health issues here in Huntington Beach? And I thought that would be a great segue for, because I know you're passionate about the mobile unit as well. So go ahead if you could.
The police department became the default entity to respond to these calls many, many years ago. And so we do our best, and our officers do yeoman's work and laudable work in addressing these needs. But I want everyone to know that it pulls often 2 officers out of the field, sometimes for hours. They end up in an emergency room, and it's my opinion that their time could be better served if they were conducting their primary function, and that's crime prevention and law enforcement duties. So the current model, as Marshall eloquently identified, is essentially there are some gaps and certain components of it are broken, and the need is ever growing. And so the police need to kind of make sure they are very good at their role, but to allow others that might be better prepared and better equipped and better trained clinically to deal with these more dynamic mental health crises throughout our community.
Great answer. I guess this might be a good time for our plug for next week. Next Wednesday night, the May 5th, the city's going to be putting on another virtual town hall meeting, and we'll be doing a deep dive into the mobile crisis response units, which I think I know Natalie and I've really done a deep dive on them, and we're very, very excited. I know I am, and I know Marshall, for those of you who don't know, Marshall's been doing this a very, very long time. He's really versed in what needs to be done, and we are seriously in good hands. And I see this being a real collaborative effort throughout the whole county. The thoughts of the possibilities really get me excited, and I just think it will be all better for it. And even our police departments will be better for it too. Natalie, did you want to say anything else about next week's meeting?
No, just I don't know if you mentioned it already. I got logged off a second ago, but just next week at the same time, we're going to be, doing a deeper dive on the mobile crisis response efforts.
Right.
And like Barbara, I agree. I think that it's really a very exciting time. And I'm especially excited about the collaborative approach at the city level between the police department, city hall, city council, and then also here with the county, and with this truly collaborative approach and community-driven approach that Marshall has started to outline. And I think that the Project Hope, I think is what we're calling it, I'm really excited about it. So next Wednesday night at 6 p.m. here on Facebook or on YouTube, please do join. Get your questions ready and be sure to tune in.
Well, I just want to say a final thank you to everyone. I know this is a real undertaking and takes some time, but we so appreciate you, Marshall, Chief Harvey, Oliver T. We appreciate you too, and Natalie. And I can't wait to the next one because it seems like every time we have a meeting, something new is revealed, and so we'll be doing something better. So thank you, everyone, and have a lovely evening and a great rest of your week.
Every new day is a gift, but sometimes it's also a struggle.
We all face dark days, and many of us are filled with pain and even thoughts of suicide.
Pain is not permanent, and I'm here to tell you there is hope.
You're not alone. You have purpose. You are loved.
And we're not meant to walk through the dark valleys alone. Please talk with someone today.
Just talk. Simply call 1-800-273-TALK. Veterans press number 1.
Let someone help. Call now.
We are stronger together. Call to talk. Hope is on the line. Call 1-800-273-TALK now.
You're not alone. Call now. If you're hurting, help is here. Call 1-800-273-TALK.